Welcome back. I'm here with Dr. Carissa Etienne. She's the Regional Director for the WHO Americas Office and the Director for the Pan American Health Organization. Thanks so much for joining me today.
Thank you so much.
To start off, can you tell me what a resilient and responsive health system means for you?
When we speak about a resilient, responsive health system, we speak about a health system that is so organized to deliver routine care within the principles of universal access to health and universal health coverage, but also a health system that is able to detect threats, be they natural disasters, infectious diseases, social and economic crises, and to scale up rapidly to respond to those. And for that to happen, we need health systems to be inclusive and participative. We need health systems that is based on a primary healthcare approach, health systems that are responsive, health systems that understand the social and economic situation within which it's placed, and health systems that also recognize all partners are important, and that not just health, but health within a broad social determinants picture.
What are your organizations doing to help to build these resilient and responsive health systems?
The Pan American Health Organization, WHO, we are an intergovernmental organization. So our action is mainly on three fronts. One, on the policy advocacy front. So we work with heads of states, we work with ministers of finance, we work with the governments and parliaments, we work with civil society to bring awareness to the fact that we need to build those health systems that are resilient, that we need to invest in those systems. It is much more cost effective to invest in strengthening and building a resilient health system than to spend those billions and many millions to react to an outbreak or a natural disaster. And then we take action in countries. So we help member states develop the policies that are pro-equity, the policies for social and economic well-being for all, no? And we work with member states to develop their reform processes, to develop their financing mechanisms, to ensure their preparedness for various disasters, to help them in terms of mitigation and response. So our action is at the global level, at the policy level, but also at the country level. And we work with partners as well to encourage all to coalesce around this whole question of strengthening health systems.
What are some of the challenges that we face when it comes to taking the steps? You talk about the lessons, but what are some of the challenges? Why can't we just take those lessons and implement them right away?
I think important challenges are, first of all, the commitment, the national commitment towards building strengthening health systems. There are many competing priorities, and health tends to get a lower level of priority than many other productive quote-unquote sectors. So that's something to overcome. I think impressing on governments that they need to have these pro-equity policies. So if you're doing health systems, it must deliver care for everyone, not just for those who can afford or those who are located close to the facility. It has to be all. I think also the whole question of prevention and promotion to be given greater priority over just curative, because when people talk about healthcare systems, they're mainly talking about curative. Right. It's strengthening your first level of care, because that's where you build resilience. It's within this first level of care. I think governments as well are sometimes loath to embrace all of society, to embrace civil society, and to embrace the private sector around planning and implementing health services. And this is something that we need to learn. Also, so the whole multi-sectoral, all of government approaches, we speak about those, but in reality, they're often not implemented, and maybe we don't understand how to do them very well. I speak about it very often in my own organization. We speak multi-sectoral engagement, but usually it's how can all of these other sectors help me? Mm-hmm. It is not from an overall consideration of how can all of us work together for the well-being of this community, of these peoples, of this population. So we have to rethink some of the methodologies and approaches.
Well, lots of work to do. Thank you so much.
Thank you so much. Yes.